Let's go back to that story, the concerns that have been raised about the lack of protective gear for health workers in KwaZulu-Natal, and bring in our guest, Mantla Shabangu, to talk to us about your concerns during this period.
Yeah, good morning. We are very concerned as Denosa, KwaZulu-Natal, because when the president announced a state of disaster, the expectation was that all managers within the province will ensure that the protective gear is put in place for those who are dealing with patients on the front line and those who are expected to nurse the patients who are confirmed to be positive. But what we have established in all hospitals in the province, there is this serious resistance in giving health workers the protective gear, especially masks, for those who are dealing with patients who are coming for the first time in the hospital, presenting with these signs, coughing, sneezing, and all of that. But they are being refused to get the protective mask. Now, the question is that why are you putting the risk of these workers, because they don't know these patients? The chairperson of the health portfolio, Mr. Lomo, made it clear before that the person you are interacting for the first time, you don't know that person and is showing some of these signs. As a health worker, you can't take a risk and pretend that the person might not be a suspect.
Tell me about this resistance. You call it a resistance to provide this gear. I mean, how is that coming? Are you being refused, or is it just not getting there?
Our members are told straight that there is shortage of this mask, so they cannot be given when it is needed. Some are even told to keep a mask for 2 days to reuse it, which we think it is very unfair and it is not serving its purpose, because our understanding is that these protective gear are bought for the nurses first so that they can protect themselves to serve the community. Now, if managers are refusing to give these nurses this protective mask, who are they keeping them for? And the danger with this is that once these nurses get infected, then the patients who will be coming to our facilities will not be assisted, because it doesn't work to keep the protective mask for people who are coming outside who might test positive. But what about those who are dealing with many patients at the same time, where managers are having very bad attitude in giving this mask? We've presented this matter to the MEC and the HOD, and they promised that they're going to follow it up. And to us, it looks like the department is trying to hide behind these managers, some of them who are very arrogant, to say, keep those masks because we are running short. Because as of last night, we have established that the Premier pronounced that they have got the assistance of 100,000 masks, which means these masks were very short and they were refusing to give nurses because they were protecting the few that were there, which we advise our members not to risk in assessing these patients without any protective gear, because they're going to be contaminated themselves.
Okay, let me ask you about that. I mean, sadly, there's a big business now in masks, isn't there? Underground business, people making a lot of money out of them at the cost of people who really need them. This advice that you're given to nurses not to come into contact to these patients, I mean, what sort of impact do you think it's likely to have, firstly on the morale of the nurses and on the potential victims?
Remember, what happens when you are nursing the sick one? You are not also immune from getting sick. So it must be clear that nurses first must be protected so that they can assist those who are sick. So it does not make sense to us that you're going to have all nurses testing positive and all be taken to quarantine, and the sick patients are coming to the hospitals and they don't get assistance. Our view is that it is a responsibility of the state to provide the PPEs so that our nurses can perform their work in a very safe environment without risking their lives and risking the lives of their families. Because if they don't have protective gears, then their life is in danger of exposing this disease to other patients and to their families.
All right, Mantla Shabangu, I mean, these nurses, they are at the front line in the fight against the coronavirus, and we're going to keep our eye on the story and push it further. Still to come.